Hi, guys.
I think we're live. Are we live? Did we do it? Got a new system going here.
Where do we look?
I know. Which way? Which way do we go?
I want to look there, but I can't.
I think we're live. If we are.
Are we working?
Can you guys hear us? If you can, give us a thumbs up, give us a heart, give us some way of knowing you guys can hear us.
Okay, I think we're live.
All right, so let me turn us down on here so that we're not listening to ourselves over and over again. Well, hello to you guys who are joining us tonight. We're super excited to have you guys watch us. If you guys are new, every Wednesday, I'm Jamie from Integrative Health and Wellness, and I have the pleasure of interviewing one of our doctors here, either Dr. Colin Consales, who's teaching a class out in our foyer, which leads me to Dr. Sarah Vibana. And, you know, it's cool that you get to talk tonight about what we're going to talk about, because I kind of have a nickname for you around here.
What is it?
And a lot of times, like, I feel like she's like the queen of babies, like the queen of infertility, because
I like babies.
she is so, oh my goodness, the amount of women that we have come in with the new babies.
Oh.
Or that are pregnant now, that were told they couldn't get pregnant, they never would get pregnant.
Yeah.
And then we have oopsies babies from some of your patients.
Yeah. So yeah. Well, that's a good testimony. I'll talk about that later. But
super exciting.
I love babies and pregnancy, and giving moms that were told they can't get pregnant the ability to become pregnant.
It's so cool to be a part of that.
Yeah.
Right?
I love it.
That's one of the things I love about being at the front desk here, is just being a part of all the positive stuff that you guys are doing for everybody, because it's so life-changing.
Yeah.
And so, and life-creating. Right?
Exactly.
This is so cool. So tonight, if you guys missed it, we're talking about PCOS today. We're going to talk about some irregular menstrual cycles, pretty much girl stuff.
Yeah. What happens down there?
Yeah, and if you're a guy joining us, I mean, it's cool for you to know this stuff too, so that you can, what do they say? Happy wife, happy life.
Or if you have daughters one day.
This is very true. So much easier to handle women when you understand, right?
What's
hormonal differences.
Yeah.
I always joke, because I think you and I are so blessed to be working with Dr. Colin, because not only is he a doctor, so he gets it, but he grew up with two sisters.
Yeah.
So it's just a really nice combo that he can just...
he's used to girls.
Yes.
He can talk to girls well.
Love that. So, okay, so we get to talk about PCOS. If you guys have any questions, or if you want to share something with us, we would love for you to do that. We always love you to encourage us with some likes and hearts, right?
Yeah, let us know we're on the right track.
Yes, and if you guys are watching and we don't get to something or one of your questions, some of you guys sent some questions over to us. If we don't get to those, just DM us and we'll do our best to get an answer back to you.
We'll get back to you.
Perfect. Okay, so let's talk about PCOS. Some of the things I guess I would want to know is, like, what are symptoms? Like, how would someone even know they had this?
Yeah, so that actually leads into like I don't know if you want to call it the definition or how you're diagnosed with it, because it's not clear really. And the simple terms of like the diagnosis would be like you don't ovulate due to having too much androgens, which are like the male hormones in your system, so that the ovaries don't release the egg to ovulate. And that's like the simplest term of PCOS. And so a lot of times people are diagnosed with PCOS without even having cysts on their ovary, which, PCOS stands for polycystic ovarian syndrome. And so you can just have like a handful of the symptoms that could happen when you have like too much male hormone in your system, and then you're diagnosed with PCOS, regardless of whether, you have cysts. So with too much male hormone, you could have, irregular periods. Could be a big one, or long periods. Periods shouldn't really last more than a little over 30 days. I'd say like 30 to maybe 34 at most. And
so wait, people with PCOS have periods that last for 30?
No, like the cycle.
Okay.
From one period to the next period, it could be longer. Like
Okay.
That's one potential symptom that you could have. is that one, you maybe don't get periods, two, they're irregular, or three, the cycle is way too long.
Which is crazy because if I missed a period, I would have not considered that a problem.
Right. And
I would have been excited about
every
this.
woman that comes to me that has been diagnosed with PCOS are like, I don't mind not having a period only a couple times a year. And I'm like, I feel you, but that's the problem.
Right.
Also, you could have like hair growth, like, male pattern hair growth, like face, or even male pattern baldness. You can have also like your skin can get dark in areas. Acne is a big one. Acne.
So how young can somebody?
I mean, anywhere from puberty on.
Oh, so I mean, young girls could have this in their teenage years.
Mm-hmm. Yeah.
And then this could present itself as an infertility later.
Yeah. Yeah. I mean, if you're not ovulating, you're not going to get pregnant.
Okay.
So, you mean, depending on the type of PCOS you have, where, if you don't have the cystic type, where it's not cysts, then you might ovulate occasionally, So you could occasionally get pregnant if everything lines up perfectly right. But it's usually harder to get pregnant. And then, like, if you aren't ovulating at all, then there's no way you can get pregnant naturally, at least.
Okay. Then how, I guess, how would you, what is the test for this?
So modern medical testing isn't clear, really. They might do ultrasounds on like your uterus and ovaries and might find cysts. They might examine you and see if you have like facial hair or dark spots or acne. And then it's mostly like clinical history is how they diagnose it, with like asking you about your period. Is it regular? Is it not? Do you have it? All of that. And then it's kind of like, we put these puzzle pieces together and it kind of fits this. So you were diagnosed with PCOS.
So how then if somebody comes here, how would you test that? How would you find out if they had that?
Well, we don't test that.
Okay.
For one. There's no way for us to know if you have cysts, and it doesn't really matter to us if you have cysts, because it doesn't change like the underlying way you have to treat cysts or any problem. Like, you have to figure out why something's there.
So for you, the cyst is a symptom of a problem.
Yeah.
And you're looking for the problem, not that symptom.
Right.
Okay.
Yeah. We do muscle testing and like the neurological testing, and we can use it to test organs, like pelvic organs. And if there is a problem, the muscle testing tests as weak, basically. And so that's enough information on our part to be like, there's something going on here. And then from there, we have more testing can see, is it your immune system involved? Because a lot of like cysts themselves, whether they're in the ovaries or other areas, is just your body's walling off something, whether it's an infection or chemicals or toxins or who knows what. It's your body actually doing its job and trying to like segregate something that shouldn't be there. And unfortunately, the cysts can cause problems itself. And so we're looking at like why, I guess, is the main thing. Like, PCOS doesn't really tell you much besides maybe you have cysts on your ovaries and also you have too much male hormone, but still it's not going to, well, great, not what type of thing.
Right.
So we're looking at like the why, and it's the overall hormone balance and all the organs that are supposed to be working together. They obviously aren't if you have one of these things. So it's like identifying what's going on. There's more things to say, but I think we'll say it.
We'll get to it.
Yeah, I don't want to just ramble for 15 minutes.
Well, I wanted to let everybody know too is, some of the people that watch us have never been here before. And so they hear muscle testing and they're like, what is that? And we always encourage everybody, there was a time where this was a new concept for me, at least. And we always encourage anyone who's never been to the clinic. You guys are the most no pressure doctors ever. Yeah. And so I always tell people the best way to learn about what that is before you come in or decide that you want to come here is to join this Wednesday class that the doctors, you and Dr. Collin, do. every Wednesday because it explains in depth
Yeah.
what you do, why you do it, scientifically why it works. But what I wanted to let everyone know is whether you've been here or not, that this is a simple muscle test. You guys use like, it's typically like our hand, and you push down, and then when you find that something somewhere is wrong, I have to tell you guys, I mean, when she finds something wrong with me and she's doing this muscle test, it is obvious that she has found something because she's not a bodybuilder, right? And so when she'll like touch something and my hand, it'll just go weak with her. Like no matter how hard I try to hold it up with her, it doesn't work. I can't do it. I'm completely weak. And so I love that during the process of you guys looking for things, it's obvious to
and get it very clear on like, this is what your weak would feel like, this is what your strong would feel like. And no, I'm not pushing harder because I honestly don't want anything to be weak.
Yeah.
Nothing.
And it's so amazing. I love that, I still, I've been here for over 2 years.
Yeah.
I still don't understand the entire process. At this point, I don't even care because I just trust you guys so much because you've helped me so much that I just trust in what you're doing. But I love that we as patients can obviously feel like, oh, that was something.
Yeah.
There was something there. So that's super cool for me. So what is your approach then whenever you do find that somebody is suffering with this?
Yeah, so that's what I want to go ahead and go back to causes. Because it kind of links into like our approach per se, and that there could be a lot of causes as to why the hormones are all crazy. One of the big ones is called like insulin or elevated insulin, which is like your blood sugar hormone. High blood sugar and high insulin levels actually will mess up your hormones. And it kind of actually stops your ovaries from ovulating. So that would be, in our testing, it'd be more like pancreas shows up, maybe intestines show up, maybe like food sensitivities show up, and also the pelvic organs show up. But what needs to be fixed is more the pancreas. And that tells me that, okay, the pancreas is sicker than your ovaries. So that is potentially the underlying cause for like the ovaries not working well. And then other top causes are like stress, whether it's like stress in your life or like actual like adrenal stress can also, elevated cortisol, adrenaline, all of that's going to throw off your hormones. And even if you think about it, like pretend we were just animals in nature, if they are going through stressful times, something's hunting them, there's no food, their body isn't gonna like want them to reproduce at that time. So the same thing happens in humans, that if you are in that like fight or flight stage, your body's not gonna be like, oh, let's bring in a cute cuddly baby in this threatening environment,
Right.
So that's one thing. In the testing, it's more like adrenals test weak then, and like those are then the sickest. And like when we ever put on like what you would need to kind of strengthen adrenals, it also strengthens ovaries and uterus too. There's a whole bunch of other ones. We have inflammation. If you have a lot of inflammation itself, that will cause hormones to be messed up. Oh, and another big one, the post-pill.
Post-pill.
Post-pill, birth control pill.
Yes, okay.
That itself.
Because isn't that typically what they use to get rid of cysts?
Yeah.
But you're saying that will,
it won't
in long term, has the potential to cause PCOS.
Yeah, because it's a hormone. I mean, you're throwing off your hormones by introducing more hormones that stop your normal ovulation cycle. And so a lot of women can go off the pill and their bodies go right back, but not all women.
So it was one of the things I was going to ask you is if you're suffering with this because you have too much progesterone, right?
No, it would be more testosterone.
Testosterone. Mm-hmm. Could I not just take, if I had this, could I not just take more estrogen?
No. I mean, that's basically a birth control pill.
Okay.
And so, I mean, they all work together. So it's not just like one hormone or another hormone. You have to have the right ratios at the right times of the month. I mean, it's really this magical science art that comes into like this whole cycle. And the more you kind of learn about like fertility And like if you are someone that wants to have a kid, you only have like a 5-day window that anything could happen, and there's really only 1 or 2 days that things are perfect, and things have to be just right for a baby to be formed. That if everything has to be working in this symphony, that it's not just like, oh, I have too much male hormone, so let's just add in the main female hormone, because there's the progesterone, there's estradiol,
Yeah.
there's a lot of hormones.
It's really cool because, like, as Western medicine, I mean, that's what I'm typically thinking is like, okay, if I have too much of this, let's just balance it out by giving me more of this.
Mm-hmm.
And although when I'm here, I sit really in front of a wall of supplements, okay, of all natural supplements, you and Dr. Colin really don't want any of us that come here taking any of these. I mean, your ultimate goal is just to get my body working so that it balances itself out and I don't need any of these supplements or.
That would be nice, but once you're healthy, it's virtually impossible to stay healthy in our world nowadays, because we have so much stuff in our air, our food, our water. Everyone else is sick, that you usually need something sometime. And so this is where we have more of the maintenance stage, where people come in a month or every 3 months or once a year, whatever kind of works for them. And we're just checking, like, maybe you need vitamin D or maybe you need calcium. Now you don't. Now you got the flu. Now you sprained your ankle. Like, it's kind of like, you're human.
So stuff's going to happen.
Stuff's going to happen.
And like the nice thing about coming in here is that you guys, I mean, I know your title is a chiropractor, right?
Mm-hmm.
But you're more, I mean, everyone who comes here, I mean, we use you as a PCP.
Yeah, we call ourselves the natural PCPs.
Because there's so much you can do for everything, right? Yeah. I remember like everyone used to call and say like, well, what can they help you with? And now like really, I feel like we should all be asking, what can you not help?
Yeah.
Because there's more things that you two can help than not.
Yeah, there's only a select amount of conditions that we'd be like, this isn't the right place for you.
So we do have, I mean, a lot of testimonies from all kinds of different people. We actually have a lot more testimonies that even are not on our website yet.
Yeah.
They're just not, we just haven't even got to them yet. But I want to encourage anybody that's watching, you guys are more than welcome to check out our website. It's www.ihwcenter.com. And then you can just find all of the testimonies that are really separated for you, so you can look up different ailments or symptoms that you're having to see how the doctors have been able to help other people that have come in with the same symptoms, ailments as you guys.
Yeah.
So do you have anything? I didn't ask you about PCOS. It's hard for me, truthfully, because this is not something that I have personal experience with, and it's so hard because I really don't understand what these women who are suffering with this, other than the infertility, what they're really suffering with every day on a day-to-day basis. So it's so hard for me to.
Well, it could be anything, really. Like, did you have regular periods? Did you have, ever have acne? Did you ever have, like, cramps? Like, there's lots of things that it could be, and that's one of, like, the point I want to get across is that there's such, like, a broad scope of symptoms that a lot of women are diagnosed with it, and I like to just use it as, okay, it's an indication you have a problem with your hormones, and that's about it, basically. Because they'll if you Google PCOS, look at like I don't remember the main website for disease, not WebMD, one of those big ones that you'd use, like the main government one.
CDC.
Yeah, if you look at CDC, they'll say like there's no known cure, like all these things, because it's kind of like they might give you birth control, maybe if cysts get big, you get surgery type of thing, but they haven't really figured out how to fix it, because one, they're looking at all the wrong causes. But I don't know. I had 2 patients that are such cool stories. I'd love to share them if you all don't mind.
Share away.
Story time. So I had one, and She was one of my first patients I had when I started. So I was fresh out of school, and she is such a sweet lady. But she was the one that like scares you when you're like fresh out of school. She comes out and we're like, I mean, she tells me her problems that she has PCOS and she can get pelvic pain so bad she has to go to the emergency room and get these crazy drugs just to not pass out from the pain and all these things. And I'm like, yeah, I mean,
You're like, oh no.
I'm like, I can help you. But I always told her, like, I like to see you at your worst.
Mm-hmm.
And she's one that lived pretty far away from here. And so I was like, if you ever get those horrible pains, I'd like you to try to get into the clinic. And she did one time. She comes in as pale as a ghost, like shaky. And I was like, you're like a new doctor. So I was like, I can do this type of thing. And where she actually had cysts, and part of her pain was either like the cyst rupturing or like something going on major down there. And we just did the routine kind of testing we would do for every visit, and found I think she needed calcium or something is what she needed at that point in time. And we actually kept her in the room, made her comfortable, turned the light off, and kind of had her take whatever she needed every 10 minutes. And she walked out of here perfectly fine. Didn't have any stabbing pains since, and has 2 kids now. So
wow.
that was like fresh doctor, like scary but also very exciting experience.
I think I know who we're talking about, so I have to ask, was she told that she could ever have kids?
I never asked her that.
Okay.
Yeah.
I'm not sure if we're talking about the same person. We can't say it anyway. But if it is who we're thinking of, because there is one person.
Yeah, that's my next story.
Oh, then this is going to be it. I'm super excited. I love this one.
Yeah. She's also a very sweet girl. And again, told me up front she was diagnosed with PCOS, but it was for her, she had other things that were more important to her to handle. So I was like, fine. And really, I do care about symptoms, but I also treat what needs to be fixed, which necessarily doesn't line up to, their main priority. I mean, their main priority will get better, but anyway.
Good to know.
Yeah. Anyways, I promise I care. Anyway, so I knew she had this, but I was just kind of fixing things, which actually turned out to be a lot of hormone problems stemming from other organs. And I don't know how long she was a patient, maybe 6 months, maybe a year at most. And she comes in and she tells me that she's pregnant. And, I'm like, yay! And it turns out it was a surprise, and, it's a happy surprise, but she was told her whole, like, puberty life, or whenever she started actually, like, getting, gyno visits, that she wouldn't be able to become pregnant because of this. And she has a healthy baby girl now.
That's the one I was thinking of.
The cutest little thing in the whole world.
She really is adorable and loves you.
Oh, I love her.
Like, she comes in, all smells, it's like she knows that she was created because of you. Like, that's the funniest thing, because she could care less about me when she comes in.
Yeah, if I could just have baby snuggles all day long,
She really would too. Like, you really would. It's, yeah, you have
I would,
baby fever when the babies come in.
Thank you.
All right, guys. So if we did not address whatever it is that you guys need, or would like to know more from a doctor about PCOS, just give us a message. If you want to know more about the muscle testing technique without, feeling any type of pressure to do anything, like you're ready to learn more, then I'm going to encourage you to give us a call. You can always call me at 724-205-6260. And just save a seat for the class on Wednesday night to learn more, and I guess just get a better feel for the doctors and stuff. And the nice thing is, if you come to that class, not only are you getting to know them and you're learning about stuff, but you actually get a substantial discount if you decide then that you want to become a patient.
Yes.
So I just love that, everyone's encouraged to learn more and just be comfortable here, which I've never had it any other place.
Yeah, I prefer if people come to the class before their first exam anyways, because it really explains everything. So they're not being like, how does that work during their exam, which is fine. I like questions, but like the amount of time that we can devote to explaining it in the class is like an hour, hour and a half versus I don't want to take up your whole exam.
Right.
Like answering questions that I would have answered in the class.
Because then you can answer more personalized questions, right?
Yeah, like about what's going on in your body.
Yes, perfect. Okay, if you guys have any suggestions of different topics that you guys would like to like us to discuss, then just shoot us those. Let us know that. We do have someone here. I was finally diagnosed a few years ago. This is how we're gonna close. We're gonna close with a question. I'm now trying to get pregnant and I'm taking progesterone to start my period. Deplin to help my mutated genes and Femera, I have no idea if I'm saying this right, to help ovulate. Any serious issues with the medication? Can I eat certain foods to help? I'm a past patient of Dr. Collins. I would love and need to come back. I know what this answer is gonna be. And it's one of the things that I love the most about you guys.
We have to test you. That's the main. I mean, usually if you have to take a medication for hormones and there's a select amount where maybe that is a route, and that could be like you have like insufficient ovaries, meaning you only have like 2 eggs left. Because the window of getting pregnant is so tiny sometimes when you have conditions like that, then yes, like our modern medical system is the way to go, and that might be like an IVF type of patient. But and I obviously don't know her clinical history, but I mean, most people, they're just given drugs and there's a reason why if something isn't working, and you can artificially change things, but if you don't fix that, there's no guarantee that like the pregnancy will hold and you won't miscarriage, or that the baby itself won't, I don't want to be mean, but like suffer from that, because like you plus dad make a baby, and the health of you plus dad determines the health of the baby. And mom will actually use a little bit of baby's organs during pregnancy. So if some of mom's organs aren't strong, you're going to use some of baby's, and then baby is born with certain organs stressed.
That and I just want to let you guys know, and that is one of the coolest things about coming in here. And I always say it, and it's just because truthfully, like I mean, I haven't felt so good in over 13 years, so it's really why like I just love you guys so much, and I'm so passionate about being here. But it's so cool because everywhere else that I've ever been, in my doctor experience, it's because everybody puts you in a box.
Yeah.
And then they would answer that question like quickly to say, okay, well, this is this and this is this and this is how that's going to relate to this for you. And everybody else who is on that same medication or in that exact same boat. And here you have to come in because they don't treat you like everybody else.
Yeah.
Like,
I mean, you're completely different. So even with foods, I mean, there's an ideal diet that humans should eat, which largely means eating less sugar. But
not even sugar. Did you catch that? Not even sugar.
But even beyond that, it depends on like what nutrients you need more of. Do you have conditions where you might have to watch insulin or sugar, then you have to eat like lower carb, or like it's.
We even at my house, because of you guys, my middle child, she'll get congested like during certain foods, and I'll be like, are you getting a cold? And she's like, no, I had corn. Because you guys found out that she's sensitive to corn products, and
Yeah.
she doesn't want to feel that way, then she won't eat corn. And I leave it up to her whether she wants to suffer. Like, is it worth her suffering to have it or not? But it's nice because it makes her responsible for that.
Right.
The
kindest way possible.
But I would have never known that.
Yeah.
I would have never known she was sensitive to corn without sending her to an allergist to put 1,000,000 needles in her back, which we did do with my younger son before we knew there were other options.
Mm-hmm.
So it's so amazing. I love that it's not like we're squares.
Yeah.
So
Yeah.
I hope that helps you guys. I hope you guys have a wonderful night. DM us if you need anything else.
All right. Bye-bye.
Bye.
Okay.
Still here.
Yes, it is here.